Hello, everyone. It's Monday, March the 15th. I'm sorry I'm late getting here. I've been with, all just the leadership of the House and just doing a whole bunch of other things and everything. Just couldn't get here. I'm sorry. As far as the deaths, since last Friday, we've had 20 additional deaths. The number still is trending the right way, which is really good. But at the same time, it's 20 great West Virginians that we've lost. Please join in prayer and everything as I read through these people's, their gender and their location and their age. And just know that we can never, ever, ever let these families become let these people just become a number. The 2,512th death is an 81-year-old female from Marion County. The 2,513th death, a 58-year-old male from Marion County. The 2,514th death, a 75-year-old female from Putnam County. The 2,515th death, a 94-year-old female from Marion County. The 2,516th death, a 54-year-old male from Berkeley County. The 2,517th death, a 79-year-old female from Ohio County. The 2,518th death, an 87-year-old female from Marshall County. The 2,519th death, a 93-year-old male from Hancock County. The 2,520th death, an 87-year-old female from Wyoming County. The 2,521st death, a 74-year-old male from Logan County. The 2,522nd death, a 65-year-old female from Brooke County. The 2,523rd death, a 65-year-old female from Kanawha County. The 2,524th death, an 89-year-old female from Ohio County. The 2,525th death, an 80-year-old male from Kanawha County. The 2,526th death, an 84-year-old male from Mercer County. The 2,527th death, a 75-year-old male from Raleigh County. The 2,528th death, an 84-year-old female from Marion County. The 2,529th death, a 54-year-old female from Raleigh County. The 2,530th death, a 74-year-old male from Mercer County. And the 2,531st death is a 97-year-old male from Kanawha County. Again, these families are hurting. Their loved ones are hurting. We've lost a ton more wisdom in the state of West Virginia. Your prayers for these great 20 West Virginians, as well as all those in a grand total of 2,531 West Virginians, is absolutely sorely needed and greatly appreciated. So thank you a bunch. As far as our numbers go, we've had 210 new positive cases in the last 24 hours. We didn't test that many people. Our daily positivity rate is at 5.48. Our cumulative positive still continues to fall at 5.33. The active cases in the state of West Virginia now are down to 5,214. That's 56 straight days that we have dropped and dropped and dropped in our active cases. And I'm looking for our recovered cases. That's 127,933. Actually, our active cases did bump up just a little bit on Saturday, so we broke the string of dropped days consecutively, but we still are at 56 total drop days. Our active cases in West Virginia, again, are at 5,214, but at one time they were 29,257 in early January. And they're down in cases by 82% since that time. And we have only 151 that are hospitalized now and 50 in the ICU units, and we do not have any red counties. I remind you again, if you're 65 years of age, absolutely go get tested if you have any symptoms, anyway, feel uncomfortable, sniffles, cold, fever, tired, anything, go get tested. If you by chance you would be tested positive absolutely we can give you these antibodies that will save your life. And if by chance you were tested, you were over 65, and your doc said, no, we can't get those antibodies or whatever like that, you call us, because that's not true. The vaccine success, since we have begun the vaccine efforts, we have seen a reduction in the weekly deaths of over 80%. We all know that. We have seen an incredible reduction in hospitalizations to under 200. We're at 151 today. By the end of this week, we will have vaccinated all West Virginia school employees over the age of 50 that wanted a vaccine. And we're also vaccinating, school employees from 40 to 50 years of age, and we should clean up all school employees, very, very, very soon. As of today, we have vaccinated 58% of the people that are over 65 years of age. Our goal is to get that to 75%, but really and truly, what we need is 75% of all those over 50, but really we need to have that even higher. Again, I keep telling you over and over and over, West Virginia. I did a show just a little while ago, The Hill, a Washington, D.C. show. And one of the questions from the lady or the man that was there, asked me, said, really and truly, don't you see that most, not most, but more Republicans than Democrats are refusing to take the vaccine? That's bad. Don't you see that in the state of West Virginia, really and truly, you've had amazing success. However, we anticipated in the state of West Virginia, if any place on earth that people would be reluctant to take vaccines, it was in West Virginia. In other words, don't you realize that you're supposed to be, a state that is more backward, than other states, and so therefore you would have more people that wouldn't be taking the vaccines, a higher percentage? Well, we're not more backward. We're not. And I have come in front of you over and over and over and said, take the vaccine. Tell me somebody somewhere that's having an absolute catastrophe, in regard to taking the vaccine. That's hard to do, really hard to do. Absolutely, I can tell you, if you don't take the vaccine, there's still a strong likelihood you're going to get this disease. And if you do, and you're older than 65 or older than 50, you're going to have a real problem, a real problem. Every day I read all kinds of people, additional people, and not one of them, I will promise you, not one of them thought, I'm going to get this disease and I'm going to die. But they do, and you could too. You need absolutely to get this vaccine. And if you can't go online, call us. If you can't get pre-registered, call us, and we'll help you, because we want you to have the opportunity to take this vaccine. You won't grow antlers. Absolutely, I promise with all in me that, to the very best of all my abilities, it is so safe, it is off the chart, and it'll save your life. From the vaccine distribution update, we're at 96% of our first and second doses, continuing to lead the nation in every way. We have a total number of doses that we've put in the arms of West Virginians of 635,801 doses. It is amazing beyond belief. Totally unbelievable. And it's a great success story by all of our health people, all of our medical professionals and experts, all the National Guard, all those at the community level and the clinics, the health clinics. It is an amazing story, and that's great stuff. Today, I'm announcing again that we are now expanding our list for pre-existing medical conditions to be eligible to receive the COVID vaccine. All adult West Virginians over 16 years of age will be eligible. All adults over the age of 16 will be eligible to receive the vaccine with the following new pre-existing medical conditions that you'll see on our screen. So if you've got any of these things and you're older than 16, you're moving right up to be able to get your vaccine. Dr. Marshall explained more about this, and we're also going to begin vaccinating essential workers of all ages. We still encourage all West Virginians to pre-register through our system, but if you can't and you're having trouble and everything getting, just call us and we'll make it all become a reality. President Biden said last week that he wants all Americans to be eligible to receive a vaccine by May the 1st, and we're confident we're going to be ready to be able to pull that off here in West Virginia. And so we're on the glide slope here. All we need you to do is join us in every way to being able to get vaccinated, and we're on the glide slope to being able to get our lives back to normal, and that's what we want more than anything. The vaccine scheduling system is up. The counties that are absolutely lagging a little bit behind are Lincoln, Ritchie, Wood, Mercer, Upshur, McDowell, Mineral, Jefferson, Wayne, Jackson, Clay, Gilmer, Calhoun, Hampshire, Berkeley, Morgan, Mingo, and Mason County. Big list. We got about half our counties, or maybe 2/3 of our counties, that are kicking butt and really leading us in regard to this, getting registered and everything. And about 1/3, or maybe even approaching half, are still lagging behind. And we need you to really get after it here in every way. We've pre-registered now 381,000 West Virginians, and that's great, but it needs to be a lot higher. From the standpoint of saving our wisdoms, clinics, we're out in all 55 counties. We continue to put as far as the priority. I'll make it easier on myself and everything. But as far as the priority, we're still going with 65 and older, but 50 and older can register, and we'll get you in the system and get your shots. There's some people out there that are still 65 and older, and they're saying, well, what about me? You haven't gotten me yet and everything. Well, we want to get you. We want to get you so badly and everything. If you'll just get in touch with us and everything, we're trying every way in the world to keep you in the front of the line. Now, so far in the state of West Virginia, just imagine this, where we started back in January. And January seems a long time ago now, doesn't it? But some 6 or 7 weeks ago, we had a feeling of hopelessness all across our elderly people. And we absolutely dropped a hammer and said, we're going to go age, and we're going to get shots in the arms of people that are 65 years of age and older. We started with 80, and we dropped all the way down to 65. Now we've dropped to 50. But so far, we have put shots in people's arm. 213,009 individuals have gotten shots that are 65 years of age and older. Now, I'm going to tell you something, and you mark it down. A bunch of those people would have died. And so, absolutely, this has been a great accomplishment from West Virginia and all the people that made it happen. I'm really proud of you. From the standpoint of our vaccine info line, you see all that up there, vaccine reminders. Again, you keep wearing your mask, and we're so close to getting rid of the mask too. It's just a little while in front of us and everything. Let's don't get in too big a hurry and mess something up here. As far as getting tested and all the free testing map, you ought to see it up there. It's all ready to go. From the standpoint of the drive-through pharmacy testing, again, we thank Walgreens and Frith for all that they've done. It's been phenomenal. We're down to 3 outbreaks in our long-term care facilities. It's amazing. Absolutely unbelievable. We have 3 outbreaks in our church community in Monongahela, Raleigh, and Nicholas counties. We got to clean that up and everything. We want that to be 0. Please get that to be 0. I would absolutely just eagerly announce that. At corrections, get this, we were 250 or whatever the other day. We're down to 34 inmate cases and 10 staff. I commend corrections beyond belief. What a job they've done. What an incredible job. We could have had disaster after disaster at our correctional facilities. It's not happened. We've lost, I think, 5 people at our corrections facilities, and that's amazing. It is really, truly, truly an incredible job. As far as our guidelines, they're up and everything, but I want to read this. All businesses must continue to follow all safety guidelines. Also, our mandatory indoor face covering requirement is still in effect. You still got to wear a mask. In a public building, wear your mask. I announced several restrictions that we lessened on our small businesses, schools, and public gatherings a few weeks ago. They're up, and they're posted on my website. As far as the face covering requirement, like I said, it's still in force. I don't like it. I can't stand these crazy masks and everything, just like you can't. But at the same time, I truly believe that being, penny wise and pound poor is not the way to go. Absolutely, we need to hold on to these masks just for a little bit longer. As far as giving blood and plasma, I encourage you with all my soul, do so. You can save a life. To be the way I feel about this whole thing, if you've gotten COVID and you've recovered, you owe something. You owe something. And if you can do this, do it. Please do it. As far as workforce, the American Rescue Plan, which is the stimulus plan of President Biden, extended unemployment benefits for Americans through September the 4th. Workforce is working with the U.S. Department of Labor on specific guidance to implement the unemployment provisions under the American Rescue Plan, under the new stimulus plan. If you are currently receiving unemployment, you will need to continue filling out your weekly certifications. Workforce has programmed their system to enable people to continue certifying, so there are no gaps in benefits once the guidelines are finalized. To ensure a seamless transaction and make sure there are no gaps in benefit payments, Workforce asked the Department of Labor and Employment for approval to deploy the extended programs before receiving official guidance from the Department of Labor. When Workforce has more guidelines, we'll let you know. I don't know how it can be more clear than just that. But we're happy with the additional dollars. I hate like crazy. We probably threw away a lot of money, but at the same time, I'm still a believer. Go big, and get this thing behind us. America needs to be back at work. Our businesses need to be thriving. This is exactly where we need to go. And West Virginia's led the way in a lot of ways. We need to continue to do so. That's all I got right now. Thank y'all.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And consistent with what the governor suggested is that we continue to work to expand eligibility for our citizens. And as we look at getting allocations of more vaccine into West Virginia, we know, as the governor said, that the discipline of our approach related to getting first shots and second shots in arms of our nursing home residents, which we're the first in the country, and our targeting our elders, our Save Our Wisdom campaign, as the governor said, has been very, very effective in reducing our weekly death rates over time to over 80%, as the governor said, and also reducing our hospitalizations dramatically from over 800 to now less than 200. So as we look at the additional groups that we know through Centers for Disease Control have higher risk of both dying and getting hospitalized with COVID-19, we have extended that list. And Jordan, I don't know if you have the slide you could put up. That's great. I can't read that, but I do have the additional list on my screen. We will extend this to West Virginians 16 and over for the Pfizer vaccine, and 18 and over for Moderna and Johnson & Johnson vaccines, who have the pre-existing diagnoses of asthma, diabetes mellitus, chronic kidney disease, heart disease, immunosuppression, lung fibrosis, chronic obstructive lung disease, blood disorders, liver disease, neurological disorder, high blood pressure, and chronic infections with diseases like HIV. In addition, as the governor said, we will extend the eligibility to all essential workers, irrespective of age, given their frontline status and helping make sure that we keep our businesses open, keep our hospitals and clinics open, keep our utilities working, and perform the other vital services and functions that are so important to West Virginia in schools and business. So that will be in all ages. And as we go forward, as President Biden has asked us to commit to have vaccines available for all Americans by May 1st, we are committed, as the governor said, to follow that. This weekend, as the governor's instructed all of us to do, we keep in contact with national connections that we have developed. And we know in Europe, they're seeing the third wave of COVID-19, generally fueled by the United Kingdom variant of COVID-19. We know in West Virginia, we only have 4 identified cases so far of the United Kingdom variant, but in some states like New York and Florida and Texas, we're seeing growth in the United Kingdom variant. And we know that this variant is faster to infect people and may make people sicker. But we also know that this variant is absolutely taken care of by the vaccines that we are using. And therefore, despite opening up to more people, which is fantastic because all the people that we've included are at higher risk to get seriously ill or die from their infection, we also want to make sure we maintain our discipline and we are taking care of our elders first and the people in our medical illness categories that we know have increased risk of dying and being hospitalized. So while we open up, we appreciate the patience of each West Virginian who is now eligible. We want you to get vaccinated. We want to protect you. We want to protect all of West Virginia. So thank you for what you're doing. Keep wearing your mask, stay physically distanced as people are getting vaccinated. But I think through the leadership of the governor and the commitment to make sure that we are opening West Virginia carefully, but maintaining our vigilance and our good behaviors as we are all getting vaccinated, that's the way that we're going to see this through and help West Virginia continue to be a beacon for the rest of our country. Thank you.
All right, thank you, Dr. Marsh. Next to the Director of the Joint Interagency Task Force, retired Major General Jim Hoyer.
Good afternoon. As the governor pointed out, we had another strong week with vaccine administration. We did achieve over 100% again in the first doses. We still have a couple of counties that we're working through second doses and scheduling related to the previous weather events, but those are moving forward this week. We continue to open up additional pathways to access vaccines. We'll work our second clinic this week with VOAD, Council of Churches, several other denominations, as well as the Benedum Foundation. That is primarily focused on grandparents, the Healthy Grandparent Program, and those grandparents who are primary care providers for some of our young adults or young children. We'll also be targeting some of our minority population through that event as well. In addition to that, we're working mobile clinics for our essential workers and are working with a number of manufacturing sites as well as folks within a variety of other industries such as the coal industry. We are also working a pilot project with WVU Medicine in the Eastern Panhandle and Shenandoah Clinic to work on access through primary care providers. The concept there is we know we still have people who have not registered on the central list, but may be more inclined to take the vaccine if they receive an outreach from their primary care provider or other doctors that service their medical needs. So we'll continue to work that as well. Another issue that we're working this week is to work with the White House office as well as the Veterans Administration to try to get a solid number from the VA on the number of West Virginians veterans who have been vaccinated through the VA system directly. So we'll continue to work all these efforts and continue to move forward as quickly as we can to get to more of our West Virginia population. Today, we are at 58% of our population over the age of 65, moving rapidly forward, and the governor continues to press us on that and the over 50 population, which we know make up the bulk of our hospitalizations and our deaths. Thank you.
Thank you, sir. Next to Dr. Aina Amjad, our State Health Officer.
Good afternoon. We are seeing a generalized trend of decreasing cases. However, we do know that spring break is coming, and we do know a lot of people are looking forward to traveling. We do want to encourage people, whether you're going to any parks or anything nearby, that we do want you to still use safety measures and practice social distancing. Also, if you're planning on traveling out of state, a lot of states have lifted their mask mandates. However, we do encourage you to wear your masks and follow these safety measures. Also, to utilize our testing that we do have available in our state. We have seen decreased numbers in our state right now. However, we are seeing some cases. So if you're having any symptoms of a sore throat or sinus symptoms, that to utilize our testing that we have available, it is still free, and we encourage you to utilize that as much as possible. Thank you.
Thank you, Dr. Amjad. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, a quick two-part question for you today, if possible. There was a clinic over the weekend in Putnam County, I believe. Church hosted it, and anecdotal reports of very young people, some as young as 21, receiving shots. I know that you have a policy to get shots in arms. Is that what happened in this instance? Because with so many West Virginians 65 and older still not receiving a shot, that can damage your efforts, at least in some eyes, if they're still not getting shots, but younger people are. So if you could fill us in on what happened there, I would appreciate it. And secondly, I keep hearing you guys saying, if you're 65 and older and you've been on this list for 3 weeks, call us if you haven't received any contact for an appointment. My question is, why don't we approach this from the other way around? You have the Everbridge system. You know who's 65 and older, and you know how long they've been on the list. Why aren't we proactively reaching out to people to call them more in a specified and focused effort? If Secretary Crouch could answer this for me, exactly how many West Virginians 65 and older are still in the Everbridge system and they have not yet been contacted? Thank you.
Okay, Jen, well, you got to do the first part of the question, and Secretary Kraut's the back part.
Yes, sir, Governor. So, Kenny, I don't, without the specific of the individual, there was a clinic that was held in Putnam County at the Taze Valley Baptist Church. It was part of the clinic run by Fruth Pharmacy, under the federal pharmacy program. My guess is that the individual could have received the vaccine for a couple of different reasons. They could have fallen into one of those health categories. It could have been an individual who was an essential worker. They did also do some service personnel from the county, and they had 115, I believe, extra doses they reported that they were able to pull out of the vials that they received. And they had less people show up for the clinics than they may have given those and opened those up to other individuals doing what they should have done, which was put shots in arms. So without the specifics, that would be my best answer to that. So, Governor, I'll turn it to Bill.
Yes, Kenny, thank you. That's a great question. Let me first say that the lists that are being pulled down now are being pulled down by county. So every county pulls their own list down of individuals. We have pushed out information asking that the pull be done in priority in terms of African Americans and minorities over age 65, individuals over 80, then individuals over 70, then individuals 65 and over. We don't have this morning's data summed. I did get that by county this morning, but the total as of, I believe it was Friday, is we had a little over 7,000 people, so actually 7,700 people over age 80 still in the system. And that system changes every day. We're now averaging about 3,600 individuals a day that are going into the system. To give you that specifically, in January, we had 14,000 people a day registering in Everbridge. In February, that dropped to 4,052 individuals a day. And March to date, we have 3,698 individuals registering in Everbridge a day. So the numbers fluctuate as people are pulled off of the list and people are added to the list. So we had 7,700 age 80 and over. And that's why the governor talks about in some counties, please get additional folks to register into the system. Age 70 and over, we had 27,500 individuals still in the system. And 65 and over, we had 22,000 individuals. So we're asking counties to pull these lists down by age and make that the priority in immunizing folks. We have some counties that don't have very many folks in that age group to pull down. So please, everyone, register into the system. We're trying to push that population as hard as we can. It's a great question, Kenny, and we can't get that message out enough to do that. So thank you for that.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, have you made any decisions yet as to how the state will use its share of funding from the latest stimulus package? I know we're supposed to get $1.25 billion again. Do you know what buckets this will be put into this time around? Thank you.
Charles, it's just too early, and you know, we're still trying to read the bill and work through all those things. And when we get a little closer and everything, we'll give you as much give you all the information that we have.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
I'm going to probably direct this to the doctors. Given all the new conditions, medical conditions that will now qualify somebody to get vaccinated sooner, is the Everbridge system going to be adopted so that you can check multiple boxes? I think when I did it, they listed heart disease and lung disease and obesity and diabetes and a few others. But now you've got a really long list. And I'm wondering if a person goes on there and they have 7 or 8 different illnesses, will they get a priority over somebody who, say, checks only one box?
Yes, Bill. Secretary Crouch, please answer.
Yes, sir, Mark. Another good question. We looked at that and we tried to make sure that what was on Everbridge when we did the first list of underlying conditions matched that, closely matched that, so that folks could check those off. We also recognize it's very difficult for physicians, local health officers, and others to make a decision with regard to priority based upon those underlying conditions, whether it's diabetes versus heart disease versus cancer, someone who's had a stroke. That is a very difficult thing to do. What we've asked and stated to the folks at doing the clinics, the local health department, local health officers, those physicians, they need to make those decisions going forward. We don't really see a clear way to make that determination, but we're looking hard at how that's done and trying to make sure the folks that are highest risk get vaccinated first. So great question again. Thank you.
All right, thank you, Mark. Next to June Leffler with West Virginia Public Broadcasting.
Hello, thank you for taking my question. As usual, I'm going to direct this to General Hoyer. So I am wondering about the Johnson & Johnson vaccine. As far as our allotment that we're getting, what percentage or amount of that is the Johnson & Johnson vaccine? And because it requires, very different means of storage and is just a one shot, I'm wondering if you all are trying to get that vaccine out to particular people?
General, please.
Yeah, so our first allotment of Johnson & Johnson was 15,500 doses. You make a great point. We are, while continuing to focus it on our target populations, we're looking at target populations where logistically it makes more sense to only do one shot as opposed to two shots. For example, some of our homebound population, some of our homeless population have already received the Johnson & Johnson doses. We're looking and working with some of our manufacturing sites because they believe that it's more logistically prudent for them to do one shot. We will be able to order again this week additional Johnson & Johnson doses, but we don't know at this point what our maximum cap for those will be. So should have more information later in the week as to how many more doses. But we do believe the Johnson & Johnson vaccine is a good vaccine to be able to use to address some of those logistical challenges in certain populations. Thank you.
All right, thank you, June. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I want to go back to the 165 unreported deaths and see if we have found out any rhyme or reason as to why it occurred like that. Early on in the pandemic, we had heard off the record that there were more monies available if someone could be classified as a COVID patient or a COVID death. Is there anything to that? And is there anything to where maybe the hospitals and long-term care facilities would look back at cases like this and then reclassify them and then add them to your rolls? Thank you.
Dr. Amjad, I think it's you.
Hi, Paul. To answer you simply, no. This is simply a data issue that we are going back and doing some quality checks on. Data reporting and collection in this case is something different to what you're referring to. When someone passes away, we have to decide, did they pass away from a malignancy or from pneumonia, and that's up to a physician at the time. So when they're filling out a death certificate, that's up to Dr. Amjad or Dr. Marsh, how we're going to put that on a death certificate. And then our death reporting system, which is what we're referring to now with this current situation, which is happening across the country, as a matter of fact. So what you're referring to as far as payment goes and COVID-19 coding systems is a separate issue and is not what we're talking about right now. Right now is simply the way we are, calculating COVID-19 deaths and death reporting, but that is not something that we're concerned with right now, if that answers your question.
Thank you, Paul. Governor, I'll turn it back to you to close up.
Well, let me just say just this. I never dreamed in a billion years that I'd sit here and tell you that things are better with 20 deaths over the weekend. They are better. We've been through some tough stuff. We're on the verge of what we hope and pray is going to be a rebound and get through the tough stuff. We need you to hang with us. Hang with us as tightly as you possibly can, as you've been all through the whole deal. And in doing so, we're going to continue to tell you the truth, the good, the bad, and the ugly, all the time. And with all of that, we're going to expect and hope that you will pull the rope with us as you've already done. Now, West Virginia, I've known it all along. It's the very reason that I'm your governor. It's the very reason that you've honored me beyond belief. But all that is just one thing, and that's this. I've known all along just how good you are, just how great you are in every way. You're the best. You're the best. And we've shown the nation over and over that I'm right in knowing that you're the best. Now let's just keep it up, West Virginia. We're close to the finish line. There's so many opportunities and everything coming our way, and I hope and pray you'll continue to listen to me in regard to your personal income tax. While I've got you, I'm going to say just one thing, and it's just this. I'm going to say this comment to all the small businesses that are out there. What if I were to say to you just one thing? How much money do we spend as West Virginians on Christmas every year? We have 732,000 households in West Virginia. What's the average spend of a household? Now, most of the overwhelming majority of those households are not very many people in the house. The average is probably 2.15 people per house. So, how much money do we spend at Christmas? How much money is an average spend across all those households? Realistically, it's probably about $500. $500 across all those households. What does that amount to? Here's what it amounts to, and stay with me just one second. It amounts to a little less than $400 million. So in other words, in West Virginia, we probably spend somewhere along the lines of $400 million. Now, I don't know exactly what it is, but if we spend $400 million a year in West Virginia at Christmas, what I'm trying to create for you is just this. Every single one of you will remain cash positive and have more money in your pockets. But I'm trying to create a situation, I'm talking to our small businesses. If you miss this and you're misinformed and you believe this is going to hurt you, you are making the worst mistake of all time. Just think about it. Think about how people buy things at Christmas. They probably buy more soda pop. They probably buy more cigarettes. They probably buy more guns. They probably buy more dresses. They buy more everything. Everything. Now, can you just imagine this and think, just think. Don't let people put in your heads these crazy ideas. Think. You own a dress shop. You own a dress shop. And in your community, all around you, everywhere, every single household as an average, some will get $300 and some will, or $350 and some will get, $3,000. But as an average, every single household will get $1,487. Now just think about it. You own a dress shop. Do you think people with $1,487 in every household are going to create a situation to where you sell more dresses? And if you don't do anything, you know where you're at right now. But all around you, everybody's got $1,487 additional dollars as an average. As an average. You know what's going to happen? You're going to have to scramble to have inventory. It's going to be the same thing at the convenient mart. It's going to be the same thing at Walmart. It's going to be the same thing at the gun shop. It's going to be the same thing at the car lots. It's going to be the same thing all across our state. And yet you've got people that are out there trying to convince you that it's going to hurt business in West Virginia. It's absolutely crazy. That's all there is to it. It is absolutely such a fallacy. It is unbelievable. Don't miss this opportunity, West Virginia. This opportunity will drive business here like you can't imagine, but what I have just explained to you is just this. This will create 2.5 more Christmas shopping seasons in West Virginia, and plus the one we already have, that's 3.5 Christmases in West Virginia a year forever. The stimulus isn't going to wear out. The stimulus isn't going to just dry up. I'm sorry, let me go back. The Biden stimulus will wear out and dry up, but not this stimulus. This stimulus will be every year, and it will only get greater as we get rid of the rest of the income tax. And it does not have one thing to do with people moving here. Now just think about what I've just said. This will stimulate our small businesses, and if you miss it, don't blame me. Absolutely, if you believe this is going to hurt small businesses, you're out of your mind. And let me go one step further. From the standpoint of our advertisers, Mark Curtis is a great man, on one of our television stations and does great work. He said to me, we're concerned because we have to sell advertising and somebody that was, let's say, spending $10,000 a year with us advertising, it's now going to cost them $10,080 a year. I think that's right. No, it's going to cost them $10,790. Okay? And for that additional monies, they may have decided, well, we want to cut back on our advertising. Now, Mark, I want you to really pay really close attention to what I'm getting ready to say. If there is $1.087 billion out in the economy all over the place, how aggressive is that advertiser going to be to get some of that business? You're going to be bombarded with advertisers. Absolutely bombarded, because they're all going to be scrambling to get some of the $1.087 billion that's out there. Same thing's going to happen to the dress shop. Same thing's going to happen to the accountants. Same thing's going to happen to the lawyers. It's going to be more business, more business, more business. And that is all without one single person moving here. Not a person. And in addition to that, they're going to flood into West Virginia with job opportunity, with higher wages, with raising our property values at our homes and everything else. If we miss this, it will just be unflat believable. Please, small businesses and people, don't let somebody influence you negatively. Learn it yourself to where you know it and know it yourself. A better economy, higher property values means better schools for the future, and on and on and on. It is your responsibility, West Virginians. I am trying in every way to educate and help you know it. Once you know it, you'll believe it just as much as me. But if you sit on the sidelines and you believe a bunch of naysayers that are out there just throwing rocks for the sake of throwing rocks, this thing could absolutely just go up in flames. And if it does, don't blame me. The opportunity is unbelievable. Just think about the little gun shop or the convenient mart. Think about the convenient mart that's sitting in Martinsburg. And all around the convenient mart, there's thousands and thousands and thousands of people that have an average of $1,400. Do you really think they're going to just drive across the state lines and not come to the convenient mart because of 1.9% sales tax? Are you kidding me? Every single item, pop, tobacco, every single item, people will be buying like crazy. We can't miss this one. This will be the miss of all time. Anyway, I wish you the very best, and with all that, I say absolutely, please remember these great families. Of the 2,531 we've lost, and absolutely West Virginia is on a trajectory here that's great, and it's great without stimulus, but stimulus is coming on top of this, and it's great for the time being at where it is and with the stimulus. But remember just this, just one thing. We've proven how to be dead last. We've proven that our population is not growing. absolutely with all in us in West Virginia, we should be this type of state. We should be a type of state that surely is not discriminating against others and is an open arm, welcoming state that loves people, loves everyone. You know, all of us have our rights to choose whatever direction that we may choose to be. But absolutely, West Virginia needs to be all embracing, surely not discriminatory. Absolutely, with all in us, we have so many things at our fingertips to market and go forward. I have absolutely taken you way down the path, and you've really been right with me. I hope and pray you'll really, really listen. And as you listen, all I ask you to do is go learn what it's all about for yourself. You know, if you think that you can buy into the shallowness of the Chamber of Commerce, who's led us, I mean, just think about where the Chamber of Commerce has led West Virginia over the last 50 years. You know what they've done? They've led us to dead last, dead last, dead last. Now, all I ask you to do is just go learn about it. Go learn. Ask yourself that one question. If I'm the dress store and everybody around me has new discretionary money, am I going to sell more dresses or not? You're dadgum right you are. And for people to try to convince you as a small business owner that this is going to adversely affect you, they're crazy. They just plain don't know. Anyway, nevertheless, thank y'all so much. God bless all y'all and everything in every way. I could never be more proud than just who you are in West Virginia. You're the best of the best. Don't let anybody tell you you're not. Be good. Thank y'all.